absolutely obscene, dangerous, bad, very costly. I mean, virtually every investment made is a con job.
Contraceptives torched. Food aid trashed. Clinics emptied. From Europe to Asia, famine zones to war zones, America's lifelines are being cut. This isn't just a budget shift. It's a global rollback. And the cost? Millions of lives erased in silence. Nearly $10 million worth of US-funded contraceptives, implants, IUDs and pills are being shipped to France for incineration. These medical supplies, stored in a Belgian warehouse, were meant to prevent unwanted pregnancies in some of the world's poorest regions. But after President Donald Trump froze all US foreign aid and shut down USAID in January 2025, the supplies became politically toxic. Multiple organizations, including UNFPA and MSI Reproductive Choices, offered to repurchase and redistribute the items. They even offered to cover all repackaging and shipping costs. But Washington refused. Instead, the US government is now spending $160,000 to destroy the supplies that won't expire for years.
This is clearly not about saving money. It feels like an ideological assault on reproductive rights.
This isn't an isolated act. Trump's freeze also gutted global HIV prevention and treatment programs. According to Jennifer Cates of KFF, a non-profit based in San Francisco, even when the president's emergency plan for AIDS relief, or PEPFAR funding, resumed under a limited waiver, entire support systems, logistics, staffing, tracking, had already collapsed. PrEP, the pill that prevents HIV among at-risk groups like gay men and trans women, disappeared from clinic shelves. Without support teams or data systems, entire regions are now flying blind on HIV transmission.
If treatment can't be delivered or monitored, it doesn't matter if the pills exist. The whole system collapses.
This isn't just a pause, it's a systemic rollback of 20 years of progress in global health. And without congressional intervention, millions of lives may go up in smoke, just like the contraceptives in France. In Dubai, 496 metric tons of fortified biscuits, emergency food meant for disaster zones, are being incinerated or dumped into landfills, despite still being edible. These calorie-rich rations, enough to feed 27,000 people for a month, were originally part of a contingency stock ordered under President Biden. But when Trump froze and then cut foreign aid, the biscuits were left to expire, as per multiple reports. US aid workers pushed back. After weeks of internal pressure, 622 metric tons were salvaged and sent to Syria, Myanmar, and Bangladesh. The rest, worth $793,000, will be destroyed before their shelf life ends. Internal USAID emails, revealed by Reuters, showed that staff were instructed not to communicate with outside organizations unless authorized, effectively halting most rescue efforts.
Emergency food doesn't expire because of rot. It expires because of politics.
And this isn't the only stockpile. Over 60,000 metric tons of US food aid are stuck in global warehouses. The US is also paying $100,000 to destroy food in Dubai, while the World Food Programme says 320 million people face acute food insecurity and nearly 2 million teeter on the edge of famine. Trump's decision to shut down USAID on February 3, 2025 isn't just a bureaucratic shakeup. It has triggered logistical collapse, confusion, and starvation in the world's most fragile regions. With USAID gone and thousands of employees laid off, there's no one left to move the food, deliver medicine, or manage aid pipelines. On the same day, Congress approved Trump's $9 billion foreign aid cut. the US Embassy in Manila announced PHP $3 billion, $51 million in aid for the Philippines. The contradiction is jarring. Across the globe, U.-funded programs for food, medicine, education, and disaster relief are vanishing. In places like Gaza, Sudan, Haiti, and Afghanistan, the cuts are shutting down clinics, schools, and shelters. Yet, new aid packages are still being funneled to strategic allies. Critics say this signals a clear pivot from humanitarianism to geopolitics.
If America steps back from aid, China and others will step in, with strings attached.
The Foreign Aid Rescission Bill, which passed the House by a razor-thin 216-213 vote, also eliminated funding for public broadcasting, including NPR and PBS, as well as emergency alert systems in rural America. The Trump administration calls this a move toward self-reliance, favouring nations that the US termed as nations willing to help themselves. Aid groups call it abandonment disguised as efficiency. Nowhere is the damage more visible than Afghanistan. On July 22nd, CNN aired footage from Nangarhar Provincial Hospital, where a one-year-old child died on camera, a victim of rising child mortality linked directly to US aid cuts. Since the suspension of $1.7 billion in US humanitarian aid, hospitals have gone dark, medicines have run out, and maternal care has collapsed. Women, children, and rural families are paying the price. Empowerment programs for women have been shelved. Mine clearance efforts have stopped. Agricultural projects are suspended. And while Republicans insist that aid could empower the Taliban, SIGAR and other watchdogs confirm that the actual share of funds reaching the Taliban is minimal. In truth, the people suffering most aren't combatants, they're civilians. From incinerated contraceptives in France, to food burning in Dubai, to dying children in Afghan hospitals, the message is clear. The US is no longer trying to lead the world with generosity. Instead, it's retreating behind cost-cutting logic and political optics, choosing where to engage based on strategic value, not human need. What was once a cornerstone of American soft power, foreign aid as diplomacy, stability, and moral leadership, is being dismantled one appropriation bill at a time. And with every ton of food destroyed and every child left untreated, the cost becomes harder to measure, not just in dollars, but in dignity, trust, and human life.